Did you know that over 264 million people worldwide suffer from depression? It's not just a bad day, it's a pervasive condition that deeply affects thoughts, emotions, and daily functions. But what really is depression? It's more than feeling sad or going through a rough patch. It's a serious mental health condition that requires understanding and medical attention. In this video series, we'll delve deep into the nature of depression, exploring its causes, symptoms, and the varied ways it can manifest across different ages. We'll look at how lifestyle choices like diet, exercise, and sleep can impact depression, and we'll guide you through the diagnosis process, discussing both traditional and alternative treatments. We'll also provide practical tips for managing depression daily and share inspirational stories of recovery and hope. Whether you are battling depression yourself, know someone who is, or simply want to understand this complex condition, this series will equip you with the knowledge to face depression with empathy and insight. Stay tuned as we unpack these topics and more, providing you with the tools to understand and combat depression. Let's embark on this journey together to uncover the reality of depression, its impact, and the effective strategies for managing and overcoming it. Chapter 1: Understanding Depression. Depression is more than just feeling sad. It's a common but serious mood disorder that affects how you feel, think, and handle daily activities. One must experience symptoms for at least 2 weeks to be diagnosed with depression. These symptoms often include a persistent feeling of sadness, loss of interest in activities once enjoyed, and an inability to perform daily activities. Depression affects approximately 264 million people worldwide, from all walks of life. Despite its prevalence, many myths surround depression, such as the idea that it's simply a result of weakness or a bad attitude. It's important to debunk these myths and understand that depression is a complex condition with psychological, biological, and social components. One interesting aspect is the body's physical response to depression. Research shows that it can alter brain function and even the structure of certain areas, like the hippocampus, which is involved in mood regulation and memory. Chapter 2: Causes of Depression. The causes of depression are multifaceted and often intertwined, involving genetic, biological, environmental, and psychological factors. Genetics play a significant role. If a close family member has been diagnosed with depression, you are more likely to develop it. In fact, twin studies show a 40% to 70% genetic link in the likelihood of developing depression. Environmental factors are also significant. Exposure to violence, neglect, abuse, or poverty can increase the risk of developing depression. Major life changes, such as the death of a loved one, the end of a relationship, or job loss, can trigger depressive episodes as well. Psychologically, personality traits such as low self-esteem or being overly dependent, self-critical, or pessimistic can contribute to the onset of depression. Moreover, traumatic events during childhood, such as parental separation or chronic illness, can alter the way one's brain reacts to fear and stressful situations, making them more susceptible to depression. Depression is a deep and complicated disorder, but understanding its roots is the first step toward effective treatment. With each person's experience being unique, the approach to managing and overcoming depression must be personalized. Chapter 3: Depression across different ages. Depression doesn't discriminate by age, it can affect anyone from young children to the elderly. However, the signs and symptoms can appear very differently depending on one's stage in life. In children, depression might manifest as irritability, academic decline, or social withdrawal. Parents and teachers might notice that a child seems excessively clingy, worried, or unhappy compared to their peers. Teenagers face a particularly high risk due to hormonal changes and social pressures. They might exhibit symptoms like sudden outbursts, a drop in school performance, changes in eating or sleeping patterns, and substance abuse. It's crucial to distinguish between typical adolescent turmoil and true depressive signs that require intervention. In adults, depression often appears as a lack of motivation, a deep sense of sadness, or a disinterest in personal and professional life. It's also linked with somatic symptoms like headaches or chronic pain. For the elderly, depression might be mistakenly attributed to aging or physical health issues. Symptoms in seniors often include memory difficulties, physical aches, and fatigue. Chapter 4: Impact of Lifestyle on Depression. Lifestyle factors play a crucial role in both the development and management of depression. Diet is a significant component. Research suggests that a diet high in fruits, vegetables, unprocessed grains, and fish can help lower the risk of developing depressive symptoms. On the other hand, a diet high in processed foods and sugar has been linked to an increased risk of depression. Regular physical activity is another powerful tool. Exercise releases endorphins, often dubbed feel-good hormones, which can improve mood naturally. Studies have consistently shown that people who engage in regular physical activity have lower rates of depression. The recommended amount of exercise is at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity each week. Sleep is equally important. Poor sleep patterns, such as sleeping too little or too much, can significantly affect mood, energy levels, and overall mental health. Consistency is key, and establishing a regular sleep routine can help mitigate some depressive symptoms. Chapter 5: Diagnosis of Depression. Diagnosing depression is a careful and detailed process, as it involves distinguishing between normal sadness and clinical depression. Health professionals typically use the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, criteria, which include experiencing at least 5 of the listed symptoms over a 2-week period. One of these symptoms must be either a depressed mood or a loss of interest or pleasure in daily activities. To accurately diagnose depression, doctors often employ several tools, including psychological evaluations, questionnaires, and discussions about thoughts, feelings, and behavior patterns. It's crucial to rule out other medical conditions that may mimic depressive symptoms, such as thyroid issues, vitamin deficiencies, or brain tumors, through physical exams and lab tests. One interesting statistic is that only about 50% of individuals experiencing depression seek treatment, which underscores the importance of awareness and better screening practices in all healthcare settings. Chapter 6: Treatment Options. Once diagnosed, the treatment of depression can take various forms, tailored to the individual's specific needs and the severity of their symptoms. The primary treatments for moderate to severe depression are medications and psychotherapy, often combined for the most effective outcome. Antidepressants can be very effective in regulating mood for many patients. However, they do not work immediately. It typically takes about 2 to 4 weeks to notice improvements. There are several types of antidepressants available, and sometimes, patients might need to try different medications to find the one that works best for them with manageable side effects. Psychotherapy, or talk therapy, is another cornerstone of depression treatment. Cognitive behavioral therapy, CBT, and interpersonal therapy, IPT, are widely used and have been scientifically validated for effectively treating depression. CBT focuses on modifying dysfunctional emotions and behaviors by addressing negative patterns of thought. IPT, on the other hand, concentrates on improving personal relationships that may be causing or exacerbating the depression. In-depth discussions on the diagnosis and treatment of depression can help viewers understand that while the journey might be challenging, recovery is possible and there are many paths they might take. If these chapters meet your expectations, let me know if we should proceed to detail the subsequent chapters. Chapter 7: Role of Therapy. Therapy plays a pivotal role in the treatment of depression, offering a safe space for individuals to understand and manage their condition. Cognitive behavioral therapy, CBT, is particularly effective, teaching patients to challenge distorted or negative thinking patterns and change unwanted behavior through various strategies. Sessions might include activities like role-playing, relaxation exercises, and journaling, which help reinforce the lessons learned. Another effective therapeutic approach is dialectical behavior therapy, DBT, which focuses on providing skills to manage painful emotions and decrease relationship conflicts. Originally developed to treat borderline personality disorder, DBT has proven effective for treating depression, especially for those who experience intense emotional swings. Psychoeducation, a component of many therapy programs, is also crucial as it helps patients and their families understand the nature of depression. By learning about the disorder, patients can recognize their symptoms early and seek prompt treatment, which can significantly improve outcomes. Chapter 8: Medication and Side Effects. Antidepressants are a common treatment for depression, but they come with their own set of challenges, including potential side effects. Common side effects include nausea, weight gain, decreased sexual desire, fatigue, and insomnia. However, the benefits often outweigh the risks for many patients, especially those with severe depression. It's important for patients to have open communications with their healthcare providers about the effects of medication. This dialogue ensures that any side effects are managed effectively and that the medication can be adjusted if necessary. For some, a combination of medications may be required to achieve the best results. Interestingly, recent developments in medication for depression include the use of ketamine, which has shown promise in treating severe cases of depression quickly, though it is generally used as a last resort when other treatments have failed. This highlights the ongoing innovations in psychiatric medication aimed at providing more effective treatments with fewer side effects. Chapter 9: Alternative Treatments. While traditional treatments like medication and therapy are effective for many, some individuals seek alternative treatments for depression. These options can include a range of non-conventional therapies that some find beneficial alongside or in place of more standard treatments. Acupuncture, for example, has been used in Chinese medicine for thousands of years and is gaining acceptance in Western practices as a method for treating depression. The treatment involves inserting thin needles into specific points on the body, which is believed to stimulate the nervous system and enhance mood. Another alternative treatment is St. John's wort, a herbal remedy used extensively in Europe for mild to moderate depression. However, it's important to consult a healthcare provider before starting this, as it can interact with other medications. Mindfulness and meditation are also gaining traction as effective practices for managing depression. These techniques help individuals focus their attention on the present moment and develop a deeper awareness of their thoughts and feelings without judgment, which can reduce stress and improve emotional regulation. Chapter 10: Living with Depression. Living with depression requires long-term strategies to manage and mitigate symptoms. Lifestyle modifications, such as establishing a routine, engaging in regular physical activity, and maintaining a healthy diet, can have profound effects on one's mental health. Social support is crucial. Regular interaction with family and friends can provide a network of understanding and assistance. Support groups, where individuals can share their experiences and struggles with depression, provide a sense of belonging and mutual aid. Finally, learning to recognize early signs of depressive episodes can empower individuals to seek help sooner. Personal coping strategies, whether they be artistic expression, journal writing, or another form of self-care, play a significant role in managing everyday life with depression.